Health Impact, PHI. I'm Phaedra Corso.
And I'm Cham Dallas. And on today's episode of PHI, we're going to discuss sexual health. But don't worry, this is a family-friendly show.
We'll be talking about important health messaging around sexual health and communication, and most importantly, prevention and public health.
This is a tremendously important issue to all of us. I think it's accurate to say that it's not generally the topic of open discussion.
And you know, Cham, it really needs to be an open discussion, because did you know that there are more than 19 million new sexually transmitted infections, or STIs, every single year in the United States?
And this has been called the hidden epidemic, precisely because of this veil of silence that surrounds this issue.
And we really need to be talking about sexual health, so much so that the Centers for Disease Control and Prevention, or CDC, has designated the entire month of April as STD Awareness Month.
Now, this is part of their effort to raise awareness not only about the importance of sexual health, but also about the importance of discussing sexual health with the appropriate people.
And those relevant people include healthcare providers, partners, and children. In today's show, we'll have an open, unbiased discussion about how important sexual health issues are, so that you, the viewer, can become an informed decision maker around these important topics.
We'll take a look at the numbers behind this hidden epidemic, and we'll look at the situation in the country and in the state of Georgia concerning sexually transmitted infections.
And then we're going to narrow our focus and come back to UGA's campus, and we'll be going to the health clinic and learning about the STIs here on our campus, and then we'll be talking with some students, some young adults, to find out the ways that they learned about sex ed when they were in high school.
We'll end the show with a discussion on the issue of communication, leaving you with some age-appropriate messages that we can use to discuss sexual health, and hopefully some strategies that the children themselves can keep safe.
So we're going to have a great show with lots of information. Please stay with us. Today it's our pleasure to have Dr. Jessica Mullenberg join us. She's from the Department of Health Promotion and Behavior, and her area of expertise is reproductive health. Jessica, before I ask you my first question, I want to read to you the CDC's definition of sexual health. Sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. That seems so broad to me. Can you help me understand this definition, or tell me how you might define sexual health?
Right. Well, it is very broad because sexual health is broad. You know, most of the time when we think about sexual health, we think about the act of having sex or what people are doing sexually. But the truth is, it's the expression and this experience that we have as sexual beings. So that can include personal values, it can include how we identify in terms of gender, because we all do things where we're not thinking about it as our sexual health, but it really is impacting our sexual health and behaviors.
Okay, so bearing in mind that definition of sexual health, how does that relate to the research that you're currently doing?
So I do a lot of work on UGA's campus. Each year I do a survey of undergrads to see what they're doing. And we look at personal value questions. We look and see how they were educated in high school in terms of sexual health. But what we are finding is that a lot of them are indeed having sex and, you know, not necessarily doing things to protect themselves from STIs.
So can you tell me, like, what's the most important thing that you've learned in this survey research that you've been doing?
Well, what I did find is that they don't want to get pregnant, and they will do anything to keep from getting pregnant. So they'll take the pill. But if they're taking the pill, they're not using condoms. And so there's no protection against STIs.
Okay, so let's talk about the STI rate.
Okay.
When we use the term sexually transmitted infections or STIs, what are we talking about exactly?
So most of the time we're talking about, because there are a lot of things that are sexually transmitted, but we're really looking at gonorrhea, syphilis, chlamydia, HIV/AIDS, just to name a few.
Okay, and how is the state of Georgia doing in regard to these STIs?
We're not doing well at all. For syphilis, primary and secondary syphilis, we're rated 3rd out of 50. For HIV/AIDS, cumulative reports, 6th, the same with gonorrhea, 6th, and with chlamydia, we're 13th. And chlamydia is actually very prevalent on college campuses.
Yeah, so let's talk about chlamydia a little bit more. Who does it impact the most, and how might we go about preventing the spread of the disease?
Well, the truth is, if you look at the stats of chlamydia, it actually follows the same trends of all the other STIs, which means that women are getting it, and also 15 to 24-year-olds are getting it. And if we're really looking at it in terms of population base, 15 to 24-year-olds are only 25% of the active sexual population, but they're getting 50% of STIs.
Wow. And so how might we prevent the spread of infections on campus?
Well, if we are looking at it, we really need to encourage use of condoms if someone is being sexually active. I mean, that is really the best way, besides abstinence, to prevent STIs.
So I want to ask you about mandatory reporting. I've heard this term mandatory reporting used quite a bit with STIs.
Right.
And I'm wondering, is the mandatory piece of this anonymous so that if I went to get screening or treatment for a sexually transmitted infection, no one's going to have my name, but it gets reported? And also, who does the reporting? Who captures that information, and what are they using these data for?
That's a great question. So basically, when someone goes into their primary care physician to get a test, it should be confidential. It's obviously not anonymous, but there are plenty of places where you can go and get anonymous testing. The most important thing is that you need to call back. Most people don't call back for their results. But STI surveillance is just like flu surveillance. It's reported to the State Department of Health, which in turn gets reported to the CDC. And we're really able to track trends of what populations are getting the diseases and the infections and where we can best put our prevention efforts. Right now, $16.4 billion is being spent on STI infections.
Wow, that is really incredible, and it shows us that we've got a lot of work in front of us. We're going to turn now to Cham, who's out in the field at the University Health Center, talking with Dr. Forehand about the STI rates on UGA's campus.
Could you give us a kind of a breakdown of what's going on here at the University of Georgia by STI and by gender?
Certainly, Dr. Dallas, and welcome back to the University Health Center.
Thank you.
Before I answer your question, let me preface that by just commenting on the difficulty of accurately defining the incidence and prevalence of an infection that is so often asymptomatic or causes no symptoms in the individual, and also infections that are at low prevalence in the community. In order to have accurate data, we need a large sample size to compare to other centers. And as regards our women's health, we have a large sample size of about 20% of all the women here on campus who come in for an annual screening every year. For men, we only see about 2% of the men. So the sample size is not quite as reliable for the men. But our data for women is very strong. And what we find is that the incidence of chlamydia is about 2.2% of all women, which is substantially lower than the community at large, but is consistent with other universities across the country. For gonorrhea, we see even a lower rate of about 0.2%. And HIV and syphilis are far lower than that. We identify 1 or 2 cases a year. So we've trended this data now for greater than 10 years by very similar methodology. And what we've discovered is that the incidence rates are flat. So we've not seen an increased incidence or a decreased incidence in these diseases in well over 10 years now.
Well, it would be important then to have an idea of what the signs and symptoms are for the public to know. What are the signs and symptoms people should be looking for?
Well, excellent question, because the majority of women certainly have no symptoms whatsoever when they're infected with chlamydia and are surprised when the report comes back as indicating an infection. And up to 40% of men have no symptoms with chlamydia specifically. Those that do develop symptoms, it's usually urinary burning. Some men will develop a penile discharge. Some women will develop a vaginal discharge. But those are very mild symptoms. As it becomes more severe and the infection is more advanced, pelvic inflammatory disease can develop, which can ultimately lead to infertility, and up to about 30% of women with chlamydia who are untreated. Can cause greater systemic symptoms such as inflammation around the liver, can cause conjunctivitis or eye infection, and can cause some trouble with joints and skin rashes. With the infections that we've discussed today, most of these are curable with antibiotics, easy treatment, and the testing is very simple and pain-free.
Of course, the ideal situation would be to avoid the STIs altogether. And to talk about that, we have here Liz Rachin, who is the Health Communications Coordinator here at the Health Center. And why don't you tell us about the programs on campus that address prevention, how we never even get here if we can avoid it.
That's right. And our health promotion department, that's what we're all about, is prevention. So essentially what we do is we have health educators that go into the classroom, go over to the sororities, go into the residence halls, and get to the students where they are. And we'll talk to students frankly about these issues, about sexual health, way to prevent disease, and any other issues surrounding sexual health.
We're now being joined by one of our students, Shupo, who is an MPH student in epidemiology. And I know you're from Nigeria, so I'm curious to know whether you had sex education program in your schools.
Well, when I went to high school, my high school was basically all male. So we didn't learn anything about sex education. We only learned sex anatomy, or in our biology classes. We didn't learn any major thing.
Is that still the case in Nigeria?
Well, sex education is an evolving field and is now more common in high schools in Nigeria, and they're focusing more on girl child to prevent unwanted pregnancies and sexually transmitted infections, both in males and females.
Okay, and so if you didn't have sex education programs in schools, then where did you learn about sexual health?
Well, I learned basically about sexual health from my college, some American movies and music, and also some friends also. So that's basically what I learned.
And so your parents were not engaged in that activity at all?
Nah, no.
Okay, is that pretty typical of?
Yes. African parents are not so liberal as you can see in America. So, but we are moving towards where the parents should teach more, because some people want the parents to be teaching more than schools also, because if parents can teach more, the children can learn more about sexual health. But parents like to keep this kind of discussion away from the children, so they learn by exploring and ending up just getting pregnant or getting sexually transmitted infections.
Great, thank you very much. We're now being joined by Robert, who's another one of our MPH students in health promotion and behavior, one of the only male students we have in health promotion. So I want to ask you about sex education in school. And let me first ask, did you grow up here in Georgia?
No, I grew up in Durham, North Carolina.
Okay, so maybe you might have some different experiences there than some of our Georgian students. So let me ask, did you have sex education programs in school?
Well, I was actually very lucky in that I had it in 5th grade, and then I had it again in high school.
Okay, and what kind of messages, if you can remember, did you have when you were in 5th grade?
If I recall correctly, it was mostly learning about puberty and stuff like that, and then learning about, I guess, abstinence. But it was saying basically abstinence is the best way, but if you're not going to be abstinent, then here's how you have safe sex.
Okay, and
like
was that in 5th grade and in high school?
Yeah, basically. And then high school, we went more in depth in it, and they taught us how to put on a condom, stuff like that, and what a condom does, how it prevents diseases and things like that.
Okay, and so how, if at all, were your parents engaged in this topic of sexual health?
I would say they were very engaged. You know, my dad's a doctor and my mom's a nurse, so they were both pretty open and talking to me about it, encouraging me that not to have sex, but if I was, then to do it safely, and here's how to do it.
And do you remember at what age your parents started talking to you about this?
I can't remember. I was fairly young, but
What does young
I would
mean
say,
to
I
you?
would say probably around 10 or 11 maybe, if I remember.
All right, and my last question for you is about the media. I think that the U.S. media has a lot of sex messaging going on, and so I just wanted to get your take on what you think the media is doing in this area.
I would say it's definitely pretty much, you can't turn on the TV without seeing some sort of sex messaging, even if it's very subliminal. I guess, take for example reality TV. You have shows like The Real World or Jersey Shore that kind of glorify having unsafe sex, or you don't really know if they're having safe sex, I guess, but they do have different sexual partners every night, and so it kind of glorifies that lifestyle.
And do you think that that has a negative impact on young adults who are, starting to think about these issues more?
Yeah, I would say so. I mean, you have probably a lot of high schoolers watching the show who don't realize as much that it's not necessarily reality, even though it's called reality TV.
Right. Well, great. Thanks very much, Robert.
Thank you very much.
This This is Jessie Barnett. She's a doctoral student in health promotion and behavior. And so we're asking the students today about sex education programs in high school. Did you, in your Atlanta school, did you have any sex education programs?
When I was in high school, I've been thinking about it, and I cannot remember having any sex ed programs in high school at all. I don't remember experiencing anything like that in high school.
Okay, how about before you got into high school?
Before I was in high school, I went to church school. It was Episcopalian school, and I remember we had sex ed in the 5th grade, and that's my only recollection of sex ed.
So from that 5th grade encounter with your sex education program, do you remember the content at all?
I remember feeling very awkward. I remember we divided the boys and the girls, and we went into separate rooms. And from that point on, I just remember feeling awkward.
Yeah.
The content, not so much, didn't stick with me very well.
Yeah, I've heard that quite a bit about sex education programs, that the awkwardness kind of blocks out any content that you might receive.
It really did for
All
me.
right, so if you had nothing in high school then, where did you get your information about sexual health?
I got a lot of it from my friends, and actually in middle school, my mom bought me, I don't remember the title of it, but it was something about the Bible of sexual health for teens. And she gave it to me, and I got a lot of my information from there.
And so she gave you a book, but did she work with you in talking about these issues?
She didn't work with me very much because I was a big reader and I processed things more on my own, and I think she knew that about me. So I just took it upon myself to read the book and talk to my friends about it. And she trusted me enough to know that I could come to her if I needed to, but she never sat me down and gave me the talk.
Okay, and let me ask you about the influence that media may have had on you as a young adult, as you're, approaching puberty and coming into sexual health awareness. What kind of influence did the media have?
For me personally, in my house, we weren't allowed to watch television very much. We could watch on the weekends occasionally. So television media didn't have a very big impact on me in terms of sexual health. I think the first thing I remember about the media and sex was Titanic came out, and I was not allowed to see it because of the nudity. So I think just for me, my friends and what they saw from TV and from the media, I got it through them, but not directly for me.
Now we have Mike Motley, who's an MPH student in health policy and management in my department. Mike, let me ask you, did you grow up here in the state of Georgia?
No, I'm actually from Little Rock, Arkansas.
What kind of health education program, if any, did you have when you were in high school?
Well, we had sort of your basic sex ed. I think it was in 10th grade, and they sort of divided us, guys over here, girls over here.
And what kind of content did they
Well,
cover in that class?
It was pretty basic. It was pretty much anatomy and how to protect yourself, just from a guy's perspective. They didn't talk about girls.
Okay, and just what is your perception on how effective that program was?
I mean, I think it was pretty effective. They didn't really tell us anything we didn't know at that point. I think they got to us a little late, maybe. But they talked about using condoms, or that abstinence is a choice that everyone can make. And
okay, and how about your parents? Were your parents ever engaged in this discussion of sexual health when you were younger?
Not very much. I think they just assumed that I think my dad thought that I already knew, and that my mom thought she was, she could still tell me later, but she tried to have the talk with me, I think, when I was about 15, and I just stopped her and said, "You're way too late. I already figured it out."
So do you think the time you had sex education in high school, it was too late as well, or did you have anything in junior high school?
Well, even back in elementary school, they tried to, when I was in 5th grade, they tried to have a sex ed day, and they showed us a video, and there was about 100 10-year-old boys or 11-year-olds, and we just laughed, and it was a riot, and then they said, "This is not going to work," and they turned it off, and we went back to class,
Right.
So they were trying to be very proactive, but we were, maybe a little too young.
We're now rejoined by Dr. Jessica Mullenberg, who's going to help me in particular, think about ways that we can talk to our children about sexual health. So Jessica, what is the first time or the appropriate time that you start having these talks with your kids?
Well, by the age of 5, they should know that we're all different, that we have different body shapes, sizes, and colors. They should also know that their body belongs to themselves. Oftentimes we make them hug our friends and family when they really don't want to. I would encourage not having them do that and really let them have a sense of who they are. Another important thing is that they should really know the actual names of their body parts.
What do you mean by that? So you can't use little nicknames that we all use?
Well, I think everyone does use nicknames, but but what we really do encourage in reproductive health is that they know the names so that it's just a normal part of the body.
Okay, so what is the next age group that you would start having more, I guess, more in-depth discussion about sexual health?
Well, they're 5 to 7. So, and you know, depending on the maturity of your child, some of these overlap, but they really need to start taking an active role in cleaning themselves and hygiene, taking regular showers and baths, brushing their teeth. They also need to know how to recognize a sexual predator. This is when we start talking about good touch, bad touch. We actually start a little bit earlier, but oftentimes we are not role playing with our children. We tell them this is good touch, this is bad touch, but we want to show our children how to turn away from someone who's making them uncomfortable, or if somebody touches them, that they should pick up the hand and move. And so that way, we're not just telling our kids, but we're showing them actually how to maneuver away from somebody who's making them uncomfortable.
Okay, I think this next age group is most important to me because my kids are 10, 11, so what about this next group?
Right, so these are the preteens, 8 to 12-year-olds. And this is when puberty starts, and we want them to start being comfortable with their body, and it's really good to start talking to them about it before it starts happening. Girls are really going through puberty earlier than they used to, and so if they can have a baby, it's good for them to know how babies are made.
Okay, and where does sex education at school come in? Is it at this age group, 8 to 12, and what do those programs look like?
They start doing it around this age, middle school. So some of them are abstinence-based, which means that they really want to delay sexual initiation as long as possible, including until marriage. And then we have comprehensive sex education that talks about empowerment and birth control methods and
All
STI
right, but
prevention.
this makes me a little bit uncomfortable as a parent, and I'm sure a lot of other parents feel the same way. I mean, how much of this sex education do I rely on the schools to provide versus how much should I be, giving this information to the kids at home?
You should really build on what's being talked about in the school. And if you're not comfortable with what's going on in the school, then say at home, hey, these are the values of our family and our community and our religion. And this is what you're being taught at school, but this is how we believe. And then what happens is the child is exposed to all sorts of ideas, and they can start building their own personal values.
All right, let's talk about probably a very tough age group, which is our teenagers.
Yes. So lots of hormones going on at that point. They're also getting a lot of sexual messages in the media. And it can be quite confusing because that is what we see as our social norms when we grow up. So what is going on in some of these television shows that we're watching or the music that we're listening to? And as parents, we're not watching the same shows or listening to the same music all of the time. But it's important to know that not everyone is having sex. That just because this may be what's being portrayed in the media, that you are in control of your own body and you don't have to do it.
All right, so for those young adults who are choosing to have sex, what can we do as parents or even as the school system, what can we do to help them prevent the spread of diseases or unwanted pregnancies?
The best way is abstinence, and that is a very public healthy way. However, not all teenagers are abstinent, and the best thing you can do is prevention, education, communication. And in that way, you're giving them real factual information on birth control and STI prevention. And then they need to really be responsible. And if they're that responsible to have sex, then they really need to be able to have the tools that they need to protect themselves.
And if I'm a parent and I feel a little bit, I don't feel comfortable having this conversation, are there resources available?
There are multiple websites. There are also books you can use. You can go to class. I had a student tell me that she went to class with her mom. And I remember thinking, oh, how horrified she must have been. But what a wonderful mother to go and participate. And that way you're not necessarily giving the information, but you can build on it and talk about it once you get home.
Great. That's very helpful, Jessica. Well, Cham, today's show really gave us a clear picture of sexual health and STIs at the national, state level, and even here in our own university.
Yes, Phaedra, it certainly did, and it also really drove home the point that any effort to curb sexually transmitted infections are going to have to be collaborative in nature.
Definitely, Cham. And Dr. Mullenberg gave us some really good information on how parents like me can talk to their children about these important health issues.
Well, this is very important since we learned that sexual health involves not only the absence of disease, dysfunction, and infirmity, but it also requires a positive approach to discussing sexuality and sexual relationships.
And we really have to provide our children and our young adults with the correct factual information about these topics so that they can be good decision makers about their own lives.
Well, as indicated by our guest today, any communication about sexual health has to be age appropriate and fact based. This is such a complicated issue with deep roots in human behavior that we have to pay particular attention to the audience.
And we not only discuss the prevention of sexually transmitted infections, STIs, but we also talked about what are some of the important signs and symptoms. And it's really critical for us to know what those signs and symptoms are, because if we leave these illnesses untreated, it can really result in some long-term, really bad outcomes.
That's right, Phaedra. So we ought to know the facts and share the facts, but in an appropriate manner.
Exactly, Cham. And progress in this area really depends on us breaking the silence and bringing the hidden epidemic to light. We thank you very much for being with us today, and we look forward to seeing you next time on PHI, Public Health Impact.